Welcome. My name is Nene Abenobi. I am the Outreach Manager for the American Foreign Service Protective Association. And we are here today to talk about Medicare and the federal health employees benefits. So hopefully you're in the right place. We want to thank you for joining us today. We have a wonderful presentation planned. I did want to let you know that today's session is being recorded. So the recording will be available after the session, and it will be emailed to all those that registered within the next 2 weeks. So if you do miss anything today, the event is being recorded. And AFSPA has been having webinars for the last few months, at least monthly, and it's been a wonderful experience. I thank you for all those that have been participating, and we are wonderful. We are glad to have the wonderful comments and feedback from you, and hoping to keep offering some interesting topics. Just to remind you, this is a Zoom webinar, not a Zoom meeting, so that's why you can't see each other from on camera, and there's no messaging amongst each other, but we will have a question and answer at the end. There's closed captioning available, as you can see on your screen. However, you are able to turn that off in your settings if you don't like the question and answer, the closed captioning on the bottom of your screen. If you do have any technology issues today, you can contact Zoom directly at support.zoom.us, and they can possibly help you with your Zoom settings or any issues that you might be having with technology. Due to time restraints, we can't take live questions during the event, but we will have a question and answer segment at the end. If you do have questions, please feel free to ask them while they're on your mind. We do have someone in the background who is going to be trying to answer any questions that come during the event. But as far as when our keynote presenter answers, that will be at the end. So feel free to type throughout the presentation, as we do have someone in place to take your questions while the presentation's going. So you will see a raise hand feature. We are not monitoring those hands during the presentation, just to let you know. So if you raise your hand, it will be lowered because we are not monitoring while the speaker is speaking. But I want to just see if everyone's awake. So we are going to do a little bit of activities with the hand right now before we get started. So if everybody can find the raise hands feature, I have a couple questions. I see some people started early. I want you to lower your hand before I answer the question, ask the question. So first question, who has some big plans for Labor Day weekend? Anyone going on vacation or have anything exciting? Raise your hand if you have Labor Day weekend plans. Okay, I see that some of us are planning on doing some exciting things, so I'm glad that you're getting out and feeling safe getting there. You can lower your hands. And I have another question. How many people think they're planning on retiring within the next 10 years? Raise your hand if you think you're retiring within the next 10 years. Okay, go ahead and lower your hands. We have a nice amount of people that are planning on retirement within the next 10 years. And then lastly, how many of you think you're going to be retiring within the next 5 years? Raise your hand. Okay, so we do have some people that are planning on retirement within the next 5 years. Well, you can all lower your hands, and we thank you for participating. We are glad that you're here. This is the right place, and this topic is relevant for anyone who is, no matter where you are in your stage of retirement planning. So I want to present our keynote speaker for today. His name is Larry Newfeld, and Larry Newfeld is retired as AFSPA's Vice President of Compliance in 2018. He currently serves as AFSPA's Medicare consultant. While employed full-time, Larry facilitated development and enhancement of the Foreign Service Benefit Plan. And Larry has an extensive 50-year background in the federal health benefits program. So we are so excited to have Larry here today, and he's going to be presenting for the rest of this event, and then I'll be back at the end for the question and answer. So without further ado, here's Larry.
Good afternoon, and welcome to our presentation about how Medicare and the FEHB work together. Relative to Nene's questions about how far out from retirement you are, first of all, let me say that the information in this presentation is current as of now. In case Congress is able to pass any regulations or laws changing that, of course, then you will need to update yourselves on it. But the chances of Congress passing anything these days is, as you know, slim. And if that didn't go over well as a joke, I apologize. All right, next slide. There are many regulations, and I encourage you to read your FEHB plan brochure as well as any information regarding Medicare. You will be inundated with materials as you get closer to age 65, none of which will be applicable to you. The information in this presentation is not applicable to anyone in the private sector. This information is applicable only to you as a federal employee or annuitant. It is not applicable to individuals within the FEHB. So first up is Medicare and overseas. They are like oil and water. They don't mix. Those of you who might have your passport handy, look at it on page 6. It says Medicare, Medicaid does not cover healthcare costs outside the US, and that's a direct quote. If you spend significant time or retire outside of the US, Medicare Part B is not for you. You will be wasting your money. But if you spend most of your time in the US, Medicare Part B might be for you. Now, regarding Medicare Part A, I call that a no-brainer. It is premium free for the people in this audience, so sign up for it at your first opportunity, no matter where you will live or travel. And I'm going to repeat this several times during the presentation. Next slide, please. Okay, there's 4 parts to Medicare. Part A is the hospital insurance. Again, it's premium free. You've been paying for it through your payroll deduction. Look at your earnings and leave statement. Sign up for it at your first opportunity, which will be 65. Part B is your medical insurance. It covers the doctors and other professionals. The premiums are subject to means testing based on income. The standard premium for 2021 is $148.50, and it does go up depending on your income. And they call that the MAGI, which is the Modified Adjusted Gross Income testing. Part C is Medicare Advantage. It is your HMOs. It includes Medicare Part B premiums, and there may be additional premiums associated with it. Not many feds have HMOs, so I'm not going to spend much time on this in this presentation. Part D is your prescription drug plans, and there are hundreds of them. The premiums for Part D are also subject to means testing. Now, I want to take just a quick moment to tell you that your FEHB plan's prescription benefits are as good or most likely better than Part D. This is called creditable coverage. And if you don't believe me, look at the inside cover of your FEHB brochure. It speaks to that. OPM has determined that all FEHB plans have prescription coverage that's as good as better than Medicare's Part D. And frankly, I'm going to give you an editorial comment right here. This is why I say Medicare Part D stands for Part Don't. You'd be throwing good money after bad. Next slide, please. All right, what does Part A cover? Well, it covers your inpatient hospitalization, hospice care, and limited skilled nursing facility, which must be skilled care, not custodial care or long-term care. Custodial and long-term care are basically the feeding, bathing, and turning the patient in bed. Most people are in skilled nursing facilities for this reason. Medicare does not pay for those services. Now, a word about skilled nursing facility. In order to qualify for them, you have to be admitted as an inpatient for 3 days and then admitted directly to the skilled nursing facility. Hospitals can keep you for several days and say you are in observation care, which is not an inpatient. So just make sure you know when you have that heart attack, are you admitted as an inpatient or observation care? And if you are in observation care, again, that does not count towards your 3-day minimum inpatient stay. Next slide, please. All right. The coverage, first of all, I want to repeat that Part A is premium free. So I encourage you to sign up for it at age 65. The coverage is, there is a Medicare Part A deductible of $1,484, and that covers your stay for days 1 through 60. And then for days 61 through 90, there is a copay per day of $371. And then if you are still in the hospital, and hopefully you won't be, your lifetime reserve requires you to pay a copay of $742 per day, and that is for days 91 and above. However, lucky for you, you are a Fed. Your FEHB plans will pay the balance of covered charges. They coordinate benefits with Medicare when you are retired and have Medicare. Now, regarding the skilled nursing facility benefits, the copay, the first 100 days, the first 20 days, Medicare pays 100%. And then for days 21 through 100, you pay $185.50. After your 100th day, you pay 100%. Now here again, you might think I'm going to say, lucky for you, you're a Fed. Not so in this case. FEHB benefits are also very limited, and coordination of benefits varies between your FEHB plans. So find out what your plan does by reviewing section 5C of your FEHB brochure. Next slide. All right, so what does Medicare Part B cover? Well, I'm going to review the slide. It covers your doctor's services and tests, outpatient hospital services, which includes observation care, limited home health services, and you must be homebound, durable medical equipment, and kidney dialysis. Regarding observation care, if you do not have Part B, then you get no coverage for it. However, your FEHB plan does pay for observation care. Medicare Part B also pays for certain preventive and screening services, but Medicare Part B does not pay for a routine annual physical. It pays for a welcome to Medicare visit, which is really nothing, and then it pays for an annual wellness visit, which is not a physical. It's where the doctor asks you, what's your weight? How are you sleeping? Are you depressed? Do you smoke? Which clearly is not a physical. Next slide, please. Before I continue about Medicare Part B costs, I want to take a moment to talk about enrolling in Medicare. Part B is voluntary at age 65. You must pay a monthly premium if you choose to take Part B. If you enroll after your first opportunity, you may incur a penalty fee, and I'll talk about that shortly. You can defer Part B under certain situations. For example, and this probably applies to most of the people in this audience, if you've been employed and covered under a group health plan based on current employment. I do want to emphasize that FEHB does not require you to take Part B. You're lucky in that regard, again, as a Fed. Private sector employers, if they do offer retiree coverage, require their enrollees to enroll in Medicare Parts A and B. FEHB does not have that requirement. Next slide. All right. How do you sign up for Medicare at age 65? Well, again, I will emphasize Part A is premium free. It's a no-brainer. Enroll at age 65. And the way you do this is you enroll 3 months before your birthday month, and 3 months after your birthday. So you have a 7-month window. There's also an opportunity to enroll during a general enrollment period. However, if you do enroll when it's not your time to enroll, the Part B late penalty with Medicare is 10% for each full 12-month period you didn't sign up. And that penalty for is as long as you continue to be enrolled in Medicare. So you need to make your decision. Either if you're already retired, then you make your decision around the age of 65. If you're waiting to retire, then what you can do is on the next slide, it tells you that you have an 8-month period after employment ends or current employment group health plan ends. Now, I want to emphasize a point here. You can continue FEHB into retirement if you're eligible, if you meet the 5-year rule. However, once you retire, FEHB becomes a retiree health plan. It is not considered current. So you need to make that decision in that 8-month window. The forms that you need to fill out are a CMS 40B, which is your application, and the CMS L564, which is proof of current coverage. Now, this must be signed by your employer, by HR. So give them enough time to fill it out and get back to you. Whatever you do, notify your FEHB plan when, notice I said when you enroll in Part A, and if you enroll in Part B. And trust me, if you don't notify your FEHB plan, they will contact you to see if you've enrolled in Medicare in any, either the A or the B. Next slide. So I mentioned that the Part B premium is means tested, and it's based on your modified adjusted gross income. So what could that mean for you? Next slide has a chart. I'll give you a few seconds to look at this chart. You might want to take out your phone and take a picture of it. Although, as Nene said, we will be distributing the recording of this. I want to emphasize again that the FEHB program does not require you to take Medicare. And the good news is Medicare does a 2-year look back in determining your premium. So when you retire, your income generally goes down, and the means testing either might not affect you as much, or it could go away as far as the higher age range, the higher income bands. You also can appeal a medication if your situation changes. And on the ending slides, I will have some websites that you can use to do your research. Next slide. All right, so what does Medicare cost you besides the premium? Well, there's a $203 yearly deductible in 2021, and Medicare pays 80% of their allowable amount, which leaves you, in most cases, a 20% coinsurance. Now, there could be extra billing by non-participating physicians. Some FEHB plans do not pay this extra billing. And for the record, the Foreign Service Benefit Plan does cover regular cost sharing and the extra billing. So if you have our plan, you're virtually 100% covered. Now, let's talk about physicians. Okay. You probably thought there were several different types based on specialty. Well, no. For purposes of this discussion, there are three types of providers. The participating providers, we call them the good guys. They agree to accept assignment, which is payment directly from Medicare, and they accept the amount that Medicare approves. We like them. They play nice in the sandbox. The non-participating providers do not accept assignment, meaning Medicare pays you and you pay the doctor. We kind of like them. They will still bill Medicare, but they can charge that extra 15% more than Medicare approved amount. Your FEHB plan pays regular cost sharing, and depending on your FEHB plan, they could pay the extra 15% balance. So review your plan's brochure in section 9. It talks about coordination of benefits, and there's a special subsection of that section that is devoted to Medicare. The third type of provider, the opt-out or the private contract providers, they are in red for a reason. These are the bad guys. They don't play nice in the sandbox. They are not in the Medicare system, and all of your FEHB plans, no matter what FEHB plan you have, can pay no more than the 20% they would have paid as if Medicare had paid them. I will repeat that. All plans in the FEHB program can pay no more than the 20% they would have paid as if Medicare had paid the doctor. This is per federal regulation. So the next slide has a chart, and I'm going to talk about the three providers. I'm going to keep the same billed amount at $1,000, and the Medicare approved amount stays at $800. So you will see in the provider accepting assignment, which is the participating provider, Medicare approves $800. Medicare will pay 80% of that, which is $640. Your FEHB plan will pay 20% of the Medicare approved amount, or $160. That leaves your liability at zero. So you're home free with the provider accepting assignment. The next column, where the provider does not accept assignment, you're still playing with one of the good guys, but they can charge a little more. And what we've done is we've set it up so that the doctor is charging 15% more than the approved amount, which brings it to $920. Medicare still will pay 80% of the approved amount. So that's still $640. Your FEHB plan could only pay $160. And again, it depends on the FEHB plan that you're in. This could leave your liability at $120, which isn't so bad. And remember, the Foreign Service Benefit Plan does pick up that extra $120. Regarding the third column, the bad guys, listen carefully. For a private contract or opt-out provider, the bill is $1,000. Medicare still approves $800, but the provider is not in the Medicare system. So Medicare pays nothing to that doctor. Your FEHB plan, again, per federal regulation, can pay only $160. That leaves you a whopping balance of $840. So I'm going to scare you. Suppose that $1,000 is for surgery, and it's a $10,000 charge. You could see where you would owe the doctor $8,400. So you're probably scratching your head and getting a little frustrated here. What do? Well, you ask your providers some questions. First, ask if they accept Medicare, if they're in the Medicare system. If they are, then ask them if they accept Medicare assignment. In other words, do they accept payment directly from Medicare? If they accept assignment, you're good. You're back at the column where you pay zero. If they don't accept assignment, then you might owe a little bit, but you're still fairly good. But if they are not in the Medicare system, if they are private contract or opt-out, you will owe them a considerable amount. So I hope I've made that clear to you, that your liability could be substantial if you don't ask your provider the right questions. Now, a lot of you have your favorite doctors, and most doctors do take Medicare. Certainly, in the higher cost areas, some of them might not take Medicare, but find out. Most of your specialists, your surgeons, they do take Medicare because they get reimbursed quite a bit amount. It's your internists and your general practitioners who might not take Medicare. Again, ask the right questions. Next slide. All right. In summary about how Medicare coordinates with the FEHB plan, if you have Medicare and you are retired over the age of 65, your FEHB plans fill most of the gaps in Medicare for services covered because Medicare A and B are going to be primary. But beware about the skilled nursing facility benefits. Your plans will coordinate coverage, which is called COB, with Medicare. The patient generally has little or no liability. Your FEHB plans, your fee-for-service plans like Blue Cross Blue Shield, GEHA, Foreign Service, we fill most of the gaps in medical coverage. But again, remember about the skilled nursing facility benefits. However, regarding your prescription drugs, the FEHB plans remain primary for them, except for very limited drugs like injections at the doctor's office, certain oral cancer drugs, and immunosuppressive drugs. Next slide. Now, I want to be fair to some of the other FEHB plans. Some of them do have incentives, which try and convince you to enroll in Medicare Part B. They will lower the co-pays or co-insurance on some of their other benefits. They might lower prescription drug co-pays, and they might offer limited, and I emphasize limited, reimbursement for a portion of the Part B premiums. Next slide. Now, I said I wouldn't spend much time on HMOs, but I do want to speak to it very briefly. Again, not many FEHB enrollees have an HMO, but if you are in an HMO, you might not need Part B coverage. Why is that? Well, if you have to pay the premiums for Part B, and you're going to stay in the geographic area that your HMO covers, then you might be okay. However, if you have family that you will visit outside of your HMO's geographic area, you might need Part B coverage because Part B will cover the services that you incur outside of your HMO's network. And also, if you incur non-emergency care in the US, if travel is involved, Medicare Part B will cover that as well. Next slide. All right. Tricare for life. Please, if you are interested in this, get out your phone. I'm going to give you a moment to take a screen print of this slide. And remember, we will be distributing this presentation in a few weeks for you. For the record, I am not a Tricare expert. I must stay in my lane. So I've done some research for you so I can provide you some information. And you can see that Part A and B enrollment is required to continue Tricare eligibility and use Tricare for life. Tricare for life is generally the last payer after FEHB and Medicare. So Tricare will probably have nothing to pay. Now you can suspend FEHB coverage if you use Medicare and Tricare for life. And I emphasize the word suspend, because if you terminate FEHB after you've retired, you cannot get back into it. Next slide. Keep that phone out, because there's some valuable resources for you to research if you are interested in continuing with Tricare. And that is definitely for the veterans in the group. Next slide. Okay, now for something completely different. We've covered what happens when you do enroll in Medicare Part B, but what happens when you don't? Well, lucky for you, you are a Fed. Your FEHB plan works just like it did before, except for this law. That is, certain charges are reduced, and this reduces your liability. I'm going to review the slide with you. The law is 5 CFR 890.905. Fee-for-service plans must limit payments for inpatient hospital care and physician care to those payments you would be entitled to through Medicare. This means that your physicians, the good guys, Medicare participating and non-participating, and the hospital cannot bill you for more than they could bill you through Medicare. You are responsible for your plan's deductibles, coinsurance, and copayments, just like you normally would. But again, your liability is lower because everybody must reduce their charges. If your providers refuse to comply with this law, show them your explanation of benefits, which states your liability under the law. There are hefty penalties for a provider if he or she does not follow the law. If you've paid more than allowed, you should ask them for a refund. And if you need further assistance, contact your FEHB plan. However, on the next slide, the bad guys are back, the ones who don't play nice in the sandbox. They are not covered by this law. But if they are a PPO physician in your plan, you still benefit from the reduced PPO charges. If they're not a PPO physician in your plan, then you're out of luck. The doctor can charge the full amount, and your FEHB plan will still follow the law. Next slide. All right, enrolling in Part B. Well, first of all, again, I want to emphasize Part A. It's free for this audience and assures full coverage when coordinating with FEHB. So why not? Part B, that's the kicker, and I'll speak to that shortly. Part C, you must have both A and B, but it's probably not to your advantage to have them. And Part D, remember, all FEHB plans have creditable coverage, which is as good or better than Part D coverage. But remember my editorial, and this is just my editorial, Part D, in my opinion, stands for Part Don't. It'll help you in deciding whether you should enroll in Part D or not. Next slide. So to be or not to be, that is the burning question. And I've put up 4 points which will help you determine whether you should enroll in Medicare. First up, will you spend a great deal of time outside of the US? If the answer is yes, then Medicare Part B might not be for you. But what happens if you don't have Medicare Part B and you are outside of the US? Well, your FEHB plan pays the same benefits, and they understand that there's no Medicare overseas, so you don't have to worry. Number 2, what's your financial situation? Well, you could be concerned about the means testing, the modified adjusted gross income, but remember, the cost of healthcare always goes up. It never goes down. I've been with FEHB for almost 50 years, as Nene said. And trust me, I remember when doctor visits were $10. I don't think you can find a doctor now where a visit is going to be under $50 at least. So remember, healthcare always goes up. And with Part B, you are virtually covered at 100%. But if you still are not happy with the means testing, I want to remind you that all FEHB plans do have catastrophic coverage. And they vary, but the catastrophic coverage is where your plan will pay 100% of covered charges for the remainder of the calendar year once your out-of-pocket has hit their catastrophic benefit. And then it starts counting back at 0 for the next calendar year. So review your plan's brochure in section 4, I believe, which talks about catastrophic coverage. Next slide. So how's your health? And I have to laugh here because when we're young, we go to the doctor once a year. As we get older, you might go twice a year. Older still, it becomes once a month. After we retire, and that's me, it becomes once a week. It is a social event. I love it. I get to speak to somebody outside of lockdown. So your health is not going to improve as you get older. And if you think you're healthy now, then think about what your parents' health was like. Think about what your siblings' health was like, and that will help you determine further whether you might need Medicare Part B. Fourth, what's your tolerance for paperwork? Well, we know that all of you just love filling out our claim forms. And if you have Medicare Part B, you don't have to worry about claim forms because the doctor files with Medicare. Medicare sends us the claim after they process it, after they've processed it, and you have almost no paperwork. Next slide. So I've put up, again, get your phones out and take a picture. I've put up 3 valuable websites, which would be OPM is the first one, Social Security is the second one, and Medicare is the third one. And for those of you who have the Foreign Service Benefit Plan, we have a booklet on our website, and there's the website URL for you, which explains how we coordinate with Medicare. And again, we do pay that extra 15% of the non-participating doctor's charges. And trust me, they will charge that extra 15% because they can. But we, just like all FEHB plans, we cannot pay for the bad guys, the opt-out of the private contract, we cannot pay, no one can pay more than the 20% that they would have paid as if the doctor was in the Medicare network. Please contact your plan to see how they coordinate benefits with Medicare and to see how they handle the non-participating providers. Next slide. Get out your phones again. There's my email address. Hopefully you do know more about Medicare and how it works with FEHB. I want to thank you for your attention to this very important topic. If you do have questions, feel free to email me. But remember, since I am retired, I don't check my emails daily. However, I will get back to you. If you want to speak to an individual or have a private situation, I can handle that on your emails. And I also do speak to people over the phone. So feel free to reach out. And Nene, I'll turn it back over to you.
This is Kyle Longton. I think you all can see me, and I've been talking with a lot of you in the Q&A. Larry, thank you very much. That was a fast but informative, a lot of information packed in there. But we did have some questions from our attendees. If I can just go through those quickly, we can maybe do a lightning round, but dive in a little bit deeper where we need to. So Larry, a question came in. If I retire at age 62, can I use my foreign service benefit plan coverage by itself until I reach age 65 and make the decision about adding Medicare?
Of course, you can. You can use your foreign service benefit plan coverage anywhere in the world, and you can continue it into retirement if you have been covered under any FEHB plan for 5 years immediately preceding your retirement. So 62, 63, 64, stay with us. We love you. Continue filing claims.
Excellent. All right. You addressed this a little bit, but I want to touch on it again. One person wrote, my spouse is a year older than I am and turns 65 next month. Does she need to sign up for Medicare even though I am still employed and we are enrolled in FEHB?
That is a very good question. Before I give you an answer, I will refer you to section 9 of your brochure. There is a chart, FEHB and Medicare. It's the, Kyle, forgive me, I'm having a senior moment. I can't remember the name of the chart, but anyways, it is in every FEHB brochure. Now, your spouse can delay enrolling in Medicare as long as you are covered under an employment group health plan. So as long as you are actively employed and covered under FEHB, then your spouse can delay coverage just like you can delay coverage.
Okay, excellent. It's that active employment that's key. Excellent. All right, so Larry, what about coverage in an FEHB plan for out-of-network doctors when you do not have Part B?
Okay, when you do not have Part B, the out-of-network doctors, as long as they are two of the good guys, the participating or non-participating, accept assignment or don't accept assignment, as long as they are one of those two, then your FEHB plan reduces the fees to the Medicare allowance, and those two types of doctors have to accept what the plan determines, which is based on the Medicare determination. If you use a doctor who's out of network and that doctor is one of the bad guys, the plan still will reduce the charges to the Medicare allowable amount. That bad guy doctor, because he's a bad guy, he might not accept Medicare's amount, and you would be on the hook for his full fee. So I hope I explained that appropriately.
Yes, I think that's good. We've had a couple questions about the alternative services that are covered under the Foreign Service Benefit Plan. So our chiropractic, acupuncture, and massage therapy. So the question came in, does chiropractic, acupuncture, and massage therapy practitioners, do they have to accept Medicare so for a member to use them before payment by AFSPA? So can you talk a little bit about how coverage with chiropractors in one field and then massage therapists and acupuncturists separately work when you have Medicare?
Sure. For chiropractors, if they're covered under Medicare, they behave just like a doctor. However, our benefits for chiropractors and also for the other two benefits are limited at a certain dollar amount. So for a chiropractor, if the Medicare approved amount is lower than our limited amount, which I believe is $50 per visit, Kyle, correct?
We
Kyle?
do 50 visits a year, up to $60 per visit.
60, it changed, forgive me, senior moment. If the Medicare amount is lower than $60, then we will base our payment on that Medicare amount, and we can pay up to that amount. If the doctor is not in the Medicare system, they're still subject to that amount, and we still will pay up to that Medicare allowable amount. If the chiropractor is in our network, then of course we will subject to the network fees. But in most cases, you probably will get up to or close to that $60 maximum. So I wanted to assure everyone of that. Regarding the other two benefits, the acupuncture and also our special massage therapy benefit, those are not Medicare benefits. So consequently, we just pay our normal liability, which is up to 50 visits per year, up to $60 per visit. Kyle,
Excellent.
did I get that right?
You got it. Yeah, that was the change we made this year. Went up to 50 visits for 2021 for each service.
Okay.
Claire, we've had a couple questions about spouses having to enroll separately. Medicare, is it an individual enrollment, or can you enroll in like a Medicare family or couple self+1 plan?
All right. Medicare is not a family affair. It is individual enrollment, individual coverage. So let me give you an example. Our CEO is a registered health underwriter. She is trained to avoid risk at all cost. You can bet when she turns 65, she will enroll in Medicare Part B. Her husband, and by the way, they do have the Foreign Service Benefit Plan. Her husband is very happy with the Foreign Service Benefit Plan's coverage and the way it works when you don't have Medicare Part B. He's also concerned about the means testing, and he doesn't want to pay that extra premium because their income together, it does put them in a higher income bracket. So he has chosen not to take Medicare Part B. So you can have warring spouses.
Absolutely. We did have a question, and this sort of applies to a few people. Can you enroll in Part B, drop it, and then pick it up again later?
Good question. The penalty is for every 12-month period in which you could have had Medicare that you didn't, Medicare slaps a 10% penalty for that full 12-month period. So I often get questions. I've enrolled in Medicare when I was first eligible, and I've been really healthy. If I drop it and then decide to take it at a later date when I get sick, what happens? That penalty kicks in for every 12-month period in which you could have had Medicare, but were not enrolled in it.
And Mary, we've gotten several questions about premiums. Specifically, does my FSBP premium change if I enroll in Part A and Part B? Is there a discount?
Well, The FSBP premium does not change. And in fact, no FEHB premium changes. And that is because when Congress enacted the Federal Employees Health Benefits Act in 1960, I was already 12 years old then, my word. They set up two tier structures, two premium tier structures, self-only and self and family. And then Congress changed it. They were actually able to pass a law, and they changed it a couple of years ago to allow for self and family. So it would literally take an act of Congress to change FEHB premiums to account for Medicare enrollment. But I want to be fair to some of the other FEHB plans. While they don't change their premiums, some do provide for limited reimbursement of Medicare premiums. And again, in the spirit of fairness, Foreign Service Benefit Plan does not do that.
Excellent. Let me just scroll through. So I did have a question here. If a member enrolls, they've got Foreign Service Benefit Plan, they enroll in Medicare Parts A and B, but they go overseas and they're just traveling overseas and they need medical care while they're there, what will their coverage be? Will it only be that 20% of the Medicare allowance, or will it be something else?
No, as I said on that slide to consider benefits, your FEHB plan will pay its normal benefits overseas because it's not a case of the foreign providers aren't in the Medicare system. Of course, they're not in the Medicare system because they are foreign providers. So it becomes a situation where there simply is no Medicare overseas. And so what happens is the Foreign Service Benefit Plan and every FEHB plan then pay their normal benefits because there's simply no Medicare.
And Larry, what advice, because we're getting a lot of questions about this, what advice do you have for someone trying to figure out if a doctor accepts Medicare, does not accept Medicare, opts out? Is there a search for that? Is it best for them to just contact their provider to find out their Medicare status?
Well, there's two answers. One is you can go to Medicare and search for a provider. However, that information might not be current. So what I urge you to do is ask your doctor a series of questions. One, are you in the Medicare system? And then the next question is, that's great. Do you accept Medicare assignment? Do you accept payment directly from Medicare? If the doctor says yes, then they're the first kind of good guy. They're the best kind of good guy. Your liability is going to be zero no matter what FEHB plan you have. If their answer is, well, we'll take you as a Medicare patient, but you have to file your claims or we'll file for you, but we don't accept assignment of benefits. We don't accept payment from Medicare. What happens in that case is Medicare will pay the patient, and the patient then has to pay the doctor for the bill. In that case, while there's still one of the two good guys, the doctor can charge up to 15% more, and it depends on what your FEHB plan does with that additional 15%. And again, for the record, the Foreign Service Benefit Plan does pay for that 15%. So remember, are you in the Medicare system? Do you accept assignment from Medicare? The next question is, I'm sorry, Kyle,
No, please continue.
I want to address
Please continue.
the private contract opt-out. If the doctor says, we have nothing to do with Medicare, we're not in the system, what my editorial comment would be, run like crazy. You want to avoid those doctors. Even if it's your favorite doctor, your financial liability could be substantial because all plans can only pay 20% of the Medicare allowable amount for those doctors who don't play nice in the sandbox.
Okay. This goes back to a question we addressed a little bit earlier, but this is a nuance on it. If you signed up for Medicare Part B, then get a job with an employer's plan, can you suspend Part B until you leave that employment and no longer have coverage under that plan?
Absolutely. What you can do is, and this happens with a lot of feds, they retire and go to work immediately or shortly thereafter for private sector. And let's say the premiums are what you can bear, or the premiums for that provider are free as an active employee, then you can delay your Medicare enrollment until you retire from that plan. So first of all, I want to make sure you know, keep your FEHB coverage. You never want to terminate your FEHB coverage. So what would happen is, in a situation like that, your employer group, let's say you go to work for IBM, IBM's health plan would be primary. Your federal employees health benefits plan would be secondary. And generally between the two, you would have no liability. Medicare's not into it because you decided not to enroll. Then once you decide to retire from IBM, that's the point at which you decide whether to enroll in Medicare Part B or not. And then that's the point at which your federal employees health benefits plan would become secondary to Medicare if you do take Medicare. But remember, as soon as you reach age 65, enroll in Part A. It's premium free.
Excellent. Well, Larry, I think we're actually out of time. I think that's all we've got time for. I'm going to try to answer some more of the questions that are still sitting in the queue by typing the answers. But Larry, thank you very much for sharing your expertise with us.
You did a great job, Kyle. Thank you for your help. And Larry, we really appreciate you sharing your expertise. I did want to let you know, once again, Larry gave his email address, and that is also going to be in the recording that you're going to get emailed within the next 2 weeks. It is larry.newfeld@afspa.org. But go ahead.
Just quickly, Nene, there is no I in my name, so please don't make that mistake.
There you go. It's larry.newfeld@afspa.org. Don't listen to the closed caption. But we thank you. We are planning on more extensive Medicare training this fall, closer to open season. So please be looking out for that invitation. You will get a post survey when the event ends. So please complete the survey. We really want to try to improve. Look out for our invitations to future webinars. And if you want to know more about AFSPA or all of our programs, you can check out aspa.org/virtual packet. Thank you for joining us today and have a wonderful afternoon. Bye-bye.
Bye, everybody.